as an insect, but a virus of some kind, and it's already infected a lot of people aboard the spaceship. So chances are you probably have the same bug as everybody else. If it is that, then it's nothing too major to be concerned about, and it can be treated with antibiotics and perhaps something else as well, depending on how severe your case may be. Okay, but obviously I'm going to need to do a few tests on you today just to diagnose exactly what is wrong with you and to make sure that it is in fact what I think it is, the same thing as everybody else aboard the spaceship. Okay, so to begin with, I just want to ask you a few questions. I think I'll write down the answers just to keep them on record for myself. Okay, one momento. Let me see, what questions do I need to ask you? I've been asking the same questions of each patient, and I want to compare the answers. Okay, so question number 1 for you. Have you been experiencing a sore throat recently? Okay, very good. Next question. Have you noticed is your tongue swollen? Not sure. Okay, there's no problem. I'm going to be checking these things today with you anyway. Next question. How is your sense of taste? Have you noticed any changes there? Okay, interesting. And same question regarding your smell. How is your sense of smell at the moment? Okay, so also slightly. Okay. And next question. Are you experiencing any ear aches at all? Both ears, yeah? Okay, no problem. Have you noticed any change in your ability to hear things? Okay. Next question for you. Are you feeling a general stiffness throughout your entire body? Okay, and have you noticed a high temperature? Perhaps you are sweating more often than usual. Okay. And have you noticed any rashes on your body? Areas of redness? Okay, I'm going to be taking a look at those as well today for you. Do I need to ask you any more questions? How is your sleep at the moment? Is that being affected by this? Okay, and what about your appetite, your diet? Are you still eating? What kind of foods are you eating at the moment? Okay, and final question for you. Are you having any difficulty breathing? listen to your heart as well, although I'm not expecting to hear any problems with your heart, but may as well check whilst I'm here doing it, okay? Very good. Okay, so I'm just going to place this stethoscope against your chest, if that's okay. Yep. Very good. And what I would like you to do is I'd like you to take a deep breath in for me now, please. And out. Very good. Different location on the chest now, listening to the lungs. And out. Okay, one more time if I may. And out. Okay. I can hear a little bit of rattling in your lungs. May indicate some mucus in the lungs, perhaps a minor infection. I have heard similar things in some of the other patients with this bug, so again, not too concerned about that at the moment. As I mentioned, just going to listen to your heart now very quickly, if I may. Okay, so just going to listen to that for about 25 seconds. Okay, very good, very good. Heart rate seems normal, rhythm is good, and the strength also seems very good, so at least your heart is in tip-top condition, so that is very good, very reassuring indeed. Okay, so what I would like to do now is I would like to look into your mouth. I'm going to use a magnifying glass for this. Okay, so if you could just open your mouth as wide as possible for me, please. Very good. I'm just going to come and have a quite a close look here. Quite a close look. Just gonna come in a little bit more. Just want to see what's going on there. What's going on there in that mouth of yours? Okay, interesting indeed. Can you open your mouth a little bit wider for me, please? Is that possible? Just a little bit wider for me. Okay, very good. Keep it like that. Can you say ah? Yeah, okay. Very good indeed. Okay, I am seeing redness, swollen. Yes, it is in keeping with everything that I've been seeing with the other patients so far. So obviously this is a new virus to me. I do wanted to take some samples from you, okay? And by samples I mean I'm going to use a few cotton buds. I'm going to take some swabs from you. One will be from your mouth, one will be from your nose, one will be from your ear. They're obviously going to be kept separate and in little containers, secured containers, and then I'm going to analyze them later in the laboratory to see exactly what kind of virus I'm dealing on in there? Lots and lots of inflammation and lots of earwax. I think most likely your body is producing more earwax than usual to try and combat the infection. I believe your ears are infected quite severely. Honestly, there's a lot of redness there, a lot indeed. What I'm going to do is I'm going to flutter my fingers near your head. I'm going to move them further away from your head, and I want you to tell me when you can no longer hear the fluttering, okay? So I'm going to start that now. Can't hear anymore. Okay, very good. We're going to do the one ear on its own. Okay, we're going to do the other ear on its own. Okay, so your hearing range is very short, and I expect it is shorter than usual. What I'm going to do is I'm going to do a very quick clean of your ears right now, just to remove some of the earwax, because there is such an excessive amount, an unnecessary amount, honestly. And cleaning some out may actually help to remove some of the infection as well whilst I'm in there. Okay, so I'll have a go on this ear now for you. that is incorrect. Once again, that smells like coconut. Coconut. Okay, we will do set number 3, just for the sake of following routine, following the test. Okay. Here comes scent number 3. Maybe you'll get this one. Have a sniff. Very good indeed. What do you think that one smells like? No. That smells like mango. That is mango. Okay, mango. Okay, so you scored 0 out of 3 there, indicating that your sense of smell is very bad indeed, and that the infection in your nose is probably quite bad. Okay. Let's move on to the taste test. Exactly the same principle, involving flavors now instead of smells, of course. So if you could open your mouth for me, I'm just going to pop a little droplet of artificial flavor on there for you. What does that one taste like? No, that's not pizza. That is not pizza. That is in fact, which one is that? Sorry. What one is that? That's honey. Honey. So quite different from pizza. Okay. No problem. Flavor number 2. Maybe this. Maybe you'll get this one. Okay. Righto. Open that mouth of yours once more for me, please. I'm just going to pop a little droplet. Droplet. On your tongue. What does that one taste like? No. It tastes like beetroot. That is beetroot. Okay. That's absolutely fine, of course, no problem. Taste number 3. I think you'll get this one. I'm optimistic. I think you will get. Flavor number 3, here we go. Okay. Open that mouth. Droplet. What is flavor number 3? No. That is incorrect. Flavor number 3 is in fact lemon. Okay, it's lemon. So you absolutely failed the taste and the smell test abysmally. You could not have performed worse, but that just indicates that you have quite the infection in the nose and the throat region. But as I've already mentioned, nothing to be concerned about, nothing that a good course of antibiotics won't cure. Okay. What I actually would like to do is take some photos of your mouth. I know that sounds a bit unusual, a little bit unorthodox, but as I've mentioned, this is a new virus, a new bug. I'm trying to document everybody that has the bug. I'm just going to use my little camera here. Okay. Let's see. Does this camera work? Yes, it does. It's just very, very slow and very, very old. Okay, let's see. There we go. It's awake. It's alive. So if you could open your mouth as wide as possible for me, please. Okay, just want to take a quick. Okay, very good. I would like to take a couple of photos if that's okay with you. Okay, so here we go. One more photo of the mouth. Very good. One more photo. Maybe a couple more. Sorry, maybe a couple more. Okay, so I'm going to use these photos in my report of this virus, just to give us all a bit of a better understanding of what it looks like. Okay, I have taken photos of everybody else's mouth as sure exactly how it spreads from person to person. If I had to guess, it would be contact, and it could be leaving germs on surfaces. Someone else comes along, touches them, transfer through contact like that. The number of patients that have this virus is quite low at the moment. Nothing to be overly concerned about, in my opinion, and also it doesn't appear to be too severe. People can still function their day-to-day lives aboard the spaceship, even though they have this virus, and even though they have a minor infection as well. Okay, but what I'm going to do is I'm going to give you now a course of antibiotics. I would like you to take these religiously. Okay, so by that I mean I need you to take 2 tablets per day. I need you to do that every single day for the next 30 days, okay? And that includes even if you start feeling better, you know what I mean? So if day 14 hits and you feel 100% better, you still need to continue and finish the entire course of the antibiotics, okay? That's just to make sure that they have the desired effect. And if you stop halfway, then we start to run into issues like antibiotic resistance. Okay, nobody wants to deal with that. That's just a bit of a headache. Okay, so please do finish the full course. Also, I'm going to be giving you some steroid cream. As I mentioned, that's just going to be applied topically onto your arms, onto the areas where the rashes are, and I would say 3 times a day would be adequate. Certainly after you have a shower, apply immediately. Just try to keep those rashes covered in cream at all times, essentially, and those should clear up within 1 week. I would probably continue to use the cream for about 7 days after it appears to have completely gone, just to be absolutely certain. Okay, that one's not quite as important as the antibiotics, but please do your best to take the medicine as I've suggested. Okay, so thank you very much for coming in today. Thank you for doing so well during all my little tests and allowing me to do my extra investigation, like taking the photos. Okay, I do appreciate your cooperation. Do you have any questions for me before you leave today? Anything else I can do for you? No? All okay? There we go then. Perfect. Thank you so much for coming, and take care. Hope you start to feel better soon.